All right, so just gonna get a little oil. And these aren't too hot, but it could still be nice to get the heat on the client first with your hand. And just gonna warm up a bit. I'm really focusing today on pin and stretch of the pecs in this area, but we wanna warm that up first. And I'm gonna focus on one side today just for the demo, but of course this is, really nice bilaterally. And if they're too hot, definitely keep them moving. Depends on the size of how much of the chest can be uncovered and the size of your hand. But a lot of times when you're in the pectoral region, you might need to work with your hand kind of on the side. And I like to use my ulnar border, that's the pinky side. Even with men, as a reminder, we're not uncovering nipples, so that's as low as we can go. And we want to stay very focused on pectoral muscle tissue and fascia when we do this work. And of course, the stones can be used on the side like the ulnar border as well. And remember, the stones can get slippery, so be careful you don't slip and slide into the vulnerable neck area. And just like any other technique, right, you can sink in more and more as you go, really work through those layers. And, this is review for almost everybody, but we really want to keep a soft hand, just like with the hot stones, and really let, the weight of your body and the strength of your body move those stones rather than a hand grip. So I'm resting the stone on that base of my hand for the work. And like we did in some other areas, you can incorporate a rolling technique. And things are really warming up quickly. I can feel working through the layers of pecs. And then you can start to feel the ribs when you do that. And all the way right under the clavicle is subclavius. So, don't be shy. Getting all the way up into subclavius. You just want to be, of course, careful with bony landmarks. So if you need to keep your other hand right there for good palpation, go for it. Now the deltoids, anterior deltoid, gets really tangled up fascially into the pecs. So, the deltoid, since it attaches on the lateral third of the clavicle, attaching here, we've got this groove between the pecs and the deltoid, and you really want to always, I would say always treat them together, right? If there's something going on with anterior deltoid, which there often is a tightness there, that is going to translate to the pecs. And I say always work them, but of course that's with client consent. Some people are not comfortable with their chest area worked, even through the sheets. So just doing some warm up. I can feel some typical tightness in the anterior deltoid. We're being careful of the bony landmarks, but we don't want to be afraid of the muscles. And I want to do just enough warm up today to show you some pin and stretch. But of course you could work a lot more in these areas.
Zefire, does it make an impact if the client's arms and hands are kind of up like Gabriel's are, or if they're down on the table, like your ability to, I don't know, stretch muscles differently? Or
yeah, good question. It does sort of change the positioning. I leave it as starting point up to client comfort. Mm-hmm. But then when we actually start the pin and stretch, I'm going to be helping maneuver them to a good place. I find in this position, kind of wherever their arms are is fine. But like when they're face down, if they've really got their arms up, you know, contorted like this, that's jamming up so much of what you're trying to release that it's good if you can move it at that point.
And they tuck their hands along their side.
Yeah, they can tuck them, and you can also tuck them with the sheet. And a lot of tables also have side inserts to widen the table. So those are kind of all options. You could also just support their arm more. May I hold your arm hand? So as soon as you really start working with the arm, you know, you just support it more so that you don't have to worry about that. And just like we did with the arm work, I'm not going to do as much arm work as I did the other day. But again, just as a reminder, you know, we're never grabbing somebody's wrists. So you see, I'm supporting him in a soft way, but I want to support him in a strong way so that he doesn't feel like he needs to help. So it's like soft and strong at the same time. Now, sometimes it feels comfortable to hold the client's hand as well. You kind of gauge that, whether that sort of feels too intimate or relaxing. Some massage therapists will sort of support the client's arm on their body even, but I err on the side of caution and do not do that. I can feel a lot of tightness right here. There's another just gorgeous stone with that beautiful iron in there. And of course, while it's fresh, I'm moving it more. Is that heat okay? You can see, of course, a lot of the pink blood coming to the surface. That's called hyperemia. You know, it's a good sign. Getting that circulation going. And once this cools down enough, I'm going to really get into this side of the pecs. And this side of the pec is called a free border. It's like a grabbable edge. And I'm going to sink in, like we did with deeper techniques, with this back edge of the stone as we get deeper. And of course, you can use different shaped stones. Too deep?
Just a little bit.
Sorry. I'm going to change the direction here and ease up. Use this, the heat, but side of my hand more. People get a lot of tightness and trigger points here. There's a lot of tightness right there. And I would say probably trigger points, but we're not going to really work trigger points today.
It looks like you barely like put oil on the skin. I don't know how you work with that.
Without much oil?
Yeah, like, it looks like you didn't put like any oil on the skin. Does that hurt like the client, or is it you can already like feel it's like perfect?
I put some oil on before we started filming, but I did go a little light on the oil today because of the pin and stretch. If I want to do more long flowy strokes, I could add some more.
It doesn't feel like you're like dragging against anything. I feel like it's a pretty good amount of oil.
Good amount, good.
I noticed with the stones that they stay moisturized because when I just use for myself,
Yeah.
I haven't put oil on a couple days. I can throw it in the heater and take it out and it still feels like it's got some oil to it.
Nice. And just making sure this is warmed up enough because it was quite tender on him. So we don't want to, you know, push through it. Gotta work through the layers. Now, obviously, he grimaced when it was too deep before. That's a very obvious sign to pay attention to. But notice that his hand is gently on my hand. I could also feel through my hand if this was not good for him. I'm enjoying this. Technical difficulty. How's it going?
Good. Does
Good.
anybody want those printouts of that routine now or?
Oh, it's a different
Oh,
routine,
no.
Jill, thank you.
I'm not giving it to you that day. Or I could.
It's for a different one, thanks, Jill.
Okay. Yeah. Talk about a multitasker. Huh?
Thanks for all that, Jill. We're still paused, yeah?
No.
Okay.
Want me to pause it?
It's cool. We'll keep going. All right, so I'm ready to do the pin and stretch, but since I got fresh stones, I want to make sure to get rid of some of the heat. Share it with the client. Now I'll make sure we get a little good the lateral aspect as well. We've been mostly talking to the anterior aspect. All right. So you can do bilateral pin and stretch like we did with the snow angels, but today I'm going to focus at one side at a time. So we're going to start with the arm kind of down, cool off the stone enough. You saw how much I warmed up the tissue already. And what you want to do with this pin and stretch is really take an area that is too tight. So we're not just like randomly putting a stone on the pecs, but we already saw earlier how it's tighter in here. And so we want to get the muscle short and the stone, it's already warmed up, and the stone holding that muscle. And then we're going to open this up. And have you had any dislocations before?
Nope.
Okay. If they had an old dislocation or a replacement on the shoulder, we don't want to go fully abducted. At the same time, we externally rotate. So this combination is the hardest for this joint. So don't do that if they had an old dislocation. You could still bring them out, but not externally rotated at the same time. Is that a good stretch? I can feel it. I'll give you a visual on that. I can feel it in this part as I'm stretching this way. So this stone, once I have it stretched, is going in this direction, and I'm focusing where it's tight. So there, it's tight right there. I'm going to engage where it's tight, which we'll do more of when we do MFR tomorrow. And then stretch it.
The stretch that you showed Jade and Taylor.
No. It is not. Oh, that's good. Is that too tight? Too much?
No.
There's a good tight spot right there.
How far up could you take that stretch? Like, could you take the arm all the way up by the ears?
Yeah, as far as it's comfortable for them, you could go, yeah. And one thing I do with my pin and stretch is, I explore and flush out the area after, so that if I'm repeating it, I'm not just repeating it in the exact same spot. What I'm doing is feeling what is released and what is left. So some of this, I can literally feel all the way down to his slippery bones. That's when I know I'm on a rib, is it's slippery. And other areas, I can still feel the tension. So if I do this again, which I'm going to find a tight area. And here's one. This was tender on him before, right? So approaching it more cautiously. Any intensity on that 1 to 10 scale? If 7's perfect, 10's too deep, 1's too light.
Sounds good.
And then we're gonna, now that it's pinned, stretch. And there's a good stretch. And I'm moving towards his other hand with my pressure for a good stretch.
If the person was flexible and their joints move more,
Yep.
quickly, would you do it differently?
It would start basically the same, but I could just go further up overhead. And where I stand and how I hold his arm might also change if I'm going to end up going further up. I could like stand on the other side, so like I'm not blocking the work, and take it further. Yeah. And so I typically repeat this a couple times where I feel what's tight, you know, what released, what's still there. Like I was saying earlier, a lot of times this kind of gets tied up into anterior deltoid as well. And, you know, there's another good spot right there. Now, even with this technique, and I'm going to say even with this technique because as you're moving the client, you might actually bump them into yourself. And I try to not touch them with any part of me that I'm not intentionally touching them with. So if we're kind of doing this little dance and I bump him into me, I just want to apologize, you know, like, sorry, that was my leg or my hip, right? Ooh. How's that good pressure? It's another good spot. Stretch. There we go. The biggest mistake I see people do at pin and stretch when they're first learning it is when they start moving the arm or whatever it is they're moving, of losing the hold they had on the muscle. So you want to keep your pressure, and in fact, you're continuing the stretch. So I'm going in the direction this muscle needs to stretch.
Do you encourage your clients to like breathe through the stretch, like take a breath with me, or like inhale now, you know?
Yeah, you can give them verbal cues on that. You can also take deep breaths yourself.
Mhm.
Some people prefer to be more direct with it. Okay, now take a nice deep breath and let it out.
Mhm.
Yeah. All right. Any other questions on this one? All right, let's pause there. And